My name is Joan Barr. I'm a registered dietitian and certified diabetes educator at Southwest Health Center. And part of my role at Southwest Health Center is to help people with diabetes.
I'm Sandy Andrews. I'm a registered nurse and a certified diabetes educator at Southwest Health Center.
With the diagnosis of diabetes, there is a lot to learn. It's a very complicated disease. It's not something that's going to necessarily go away. It's something that will be part of your health history forever. And so the diagnosis of it can be challenging at best to people when they're not expecting.
Diabetes is actually a chronic condition, and it's caused by inability of the body to properly use the glucose that's in the bloodstream to convert it to the cells for energy. Right. Type 1 diabetes, we usually see that develop in children and young adults. Type 1 is a chronic condition. It's where the body actually does not produce any insulin at all. The cells that normally produce insulin in the body are actually destroyed, and so the body has no insulin production. So in these people, we usually see a very rapid onset of symptoms, and these symptoms usually include extreme thirst, excessive urination, weight loss. If it goes on to progress over time, these people usually end up in the emergency department, possibly with extreme abdominal pain, nausea, vomiting, and with a very high blood sugar, which is actually a medical emergency.
Type 2 diabetes typically means that the body isn't using the insulin that it does have to move the blood sugar into the cell, or the body is not putting out enough insulin from the pancreas in order to move the blood sugar from the bloodstream into the cell. Symptoms for diabetes, usually they develop very slowly, especially in type 2 type people with diabetes. They start out with maybe some excessive thirst, some excessive urination, there might be some weight loss, or they might be just plain tired. And the symptoms kind of come on very slowly until the person gets to the point of just feeling awful. And they're like, I just have to go to the doctor, I'm just not feeling well. And usually what ends up happening is the doctor will go in, the patient will talk about being really tired, maybe they have an infection that's not going away very quickly, maybe a sore on their skin or maybe some pneumonia, and the doctor will check a blood sugar and they'll find that it's elevated.
Risk factors for diabetes. Probably some of the main risk factor I would say for type 2 diabetes would be family history of diabetes. If you have a first degree relative, either a parent or brother or sister with diabetes, definitely at a higher risk. Women who have had gestational diabetes in the past, that would definitely be a risk factor for developing diabetes later on. Certain ethnic groups, which could include African American, American Indian, Pacific Islanders, they all have a higher risk factor, although I really see an increase in the incidence of Caucasians just because of our lifestyle. That would include increased obesity because of, I think, related to a lot of our fast food and the way just our lifestyles not being as active, so inactivity would be another risk factor.
If you suspect that you have diabetes, probably the most important thing to do would be to check with your healthcare provider. Meet with your healthcare provider, discuss your symptoms and why you feel you might have diabetes, and then the healthcare provider can order a lab test.
Diabetes is a very manageable condition. It can be managed by, number one, education is a big part of that management, a healthy diet, activity, and medication. This can be very easily managed with the combination of all of those along with your healthcare providers.
If you do find out you have diabetes, the best thing to do would be to follow the recommendations from your healthcare provider. And we'd also like to think that there would be an order for some diabetes education, and that's where Sandy and I come in at Southwest Health Center. We are able to help the patient understand the diagnosis of diabetes, understand the purpose for the medications that the healthcare provider may have ordered, how to do a blood sugar monitoring test, talk about a healthy diet and how we can implement that in that person's life. We try to take the patient from where they are in their understanding of diabetes and help promote it to make them the healthiest person that they can be.
If you find out that you have diabetes, often it's an overwhelming diagnosis and it's like, what am I going to do now? I'm going to have to live with this for the rest of my life. What is true, number one, is that you do have a chronic condition. You do have to live with it the rest of your life, but it can definitely be, again, it's something that's not going to go away, but you can certainly you can do everything that somebody without diabetes can do.